Once we have loaded the patient's photographs into our software management program on our computers, we can then pick up a treatment planning template at the Institute website. And I'm going to show you how we use this for our treatment planning. This is a three-step process involving assessing initially periodontal condition, gingivitis versus periodontal disease, secondly anterior procedures, and then thirdly back of mouth procedures and potential specialist referrals. So with the template, I will look at my x-rays and assess has there been bone loss that warrants a periodontal condition that may, at the end of primary care therapy, require referral to a specialist. And in this situation I have made the judgment call with the bone loss that I believe there is. So I will take the template and tick the area that relates to the specialist referrals. If the patient has made comment about the desire to improve the colour of their teeth, then the second stage of the procedures that I would tick relate to bleaching procedures, whether they be home bleaching procedures or in-office bleaching procedures. The second step is the anterior procedures that we're going to be assessing. So the pictures that I bring up at this stage to assess that is the non-retracted smile, the retracted smile, the occlusal view of the upper and the occlusal view of the lower. Now the patient has presented concerned with the aesthetic improvement in her smile, and as we can see the smile is relatively short, not running parallel to the lower lip line. We have seen in previous pictures and x-rays that we have two implant crowns here. So when I pick up my template, we have everything in here we potentially could use. Now given that the lower anteriors are relatively straight and the upper are going to be rebuilt, I have no need for the orthodontic assessment and the orthodontic treatment, so I remove that from the template. My treatment coordinator is then aware of the fact that this is to be removed from the treatment plan. As I move down to the teeth and start to look at what my recommendations are going to be, we're going to be looking at two implant crowns on the centrals. The laterals are very heavily filled with veneers across the facial aspect of them, but requiring rebuilding due to cracks internally. So I'm going to be recommending full porcelain crowns there. And the potential in the eye tooth situation, because one of them has had bonding, to place veneers on one or both of those eye teeth. Obviously, from the ability to colour match, I'd be recommending doing both of those. Now, the patient may suggest if only one is to be done, they may say only one of them. My recommendation would be to do two. So in my templating area, under upper teeth, I would be putting two implant crowns, two adjacent crowns, and two veneers. All my anterior restorative procedures, I like to provide the patient with a night splint to protect against nighttime bruxing. So we are going to include the night splint, which is in the template, and the lower teeth, as we see in this area here, are in a relatively good position, so I don't see any need for recommendations there. So in my template, I'm going to cross this area that relates to lower teeth out. So my template is now prepared to go off to reception to be retyped. The third step in our treatment planning template system is the back of the mouth areas. And at this stage we bring up upper right, upper left, lower right and lower left photographs. And as we look at these, we're making judgment calls on whether the large heavily filled teeth are going to be straightforward fillings or potential rebuilds. I mostly err on the side of a rebuild, and I find that when I'm inside teeth like this, often there are cracks present. It's a whole lot easier to advise the patient that your initial concerns are well founded and there is a need to rebuild, rather than feeling that this may well be a refill situation and then you find the crack and have to advise the patient that tooth will have to be rebuilt, which was not diagnosed initially. So that's why I tend to err on the higher side. So on my upper right hand side, I have one tooth that's potentially rebuilt, and on my back of mouth section I will put one rebuild, one refill and one sealing area, and it's highlighted in my template. I do the same to the left, and I look at these areas here and feel that these are simply filling replacements and reviewing my x-rays to confirm there's no depth issues there. I put 3 refills and cross out the rebuilds and the sealing. On the lower right-hand side, I have 3 teeth in question: small old composite, larger composite and old amalgam. I would be recommending that this is 3 filling replacements here, crossing out rebuilding and sealing. And on the lower right-hand side, I've got larger amalgam fillings here. This is the grey zone in terms of, are these going to be simply refillings or rebuildings? I would put 3 refillings and then in brackets, potential rebuilding if cracks found. And I would write that down on my template. The template has a costing structure which you can put in your own costings. You've got fissure sealing, refilling, rebuilding, sometimes crown replacement and implants. And if any of these are not to be used, simply remove them from there. The final overview I would apply to my treatment plan template is whether there's going to be any specialty referrals. And at the end of my template I had my specialist referrals. I've included, for completeness, orthodontist, oral surgeon, periodontist and endodontist. If any of these are not involved, they are simply crossed out. So the orthodontist is not a recommendation on this one. Oral surgeon for wisdom teeth is not relevant. The periodontist is, as we've made mention earlier, there is periodontal conditions we're concerned about, so I would leave that in, and my treatment coordinator is aware of that. And on the last page I have my endodontist referral. I'll often leave that in where there's medium to large fillings. Again, I will simply tick the box there. There is disclosures for the patient on all of the essential care and maintenance responsibilities, risks of root canal, the patient's responsibility in terms of turning up to appointments and their payment terms and the like. So obviously you can take this template as available on our website, make adjustments accordingly both on the basis of cost and also the copy that you may want to place in there that's relevant to your practice. The final stage in the utilisation of the treatment plan template is to provide the marked up copies to the treatment coordinator, who then can complete that into the final copy for the patient's recommendations. Provide 2 copies, one for the patient to be signed and our copy to be signed by the patient as well. Gives them a clear understanding of the recommendations, the patient's responsibilities and everything that is required to embark upon treatment. I'm sure if you follow the treatment plan template process, you'll have a full and thorough diagnosis of the patient's conditions and case acceptance will no doubt be much higher.